Well, a warning tonight for pregnant women, especially in Ghana. A new report finds some medicines used during and after pregnancy may not meet the required standard of quality. We are talking about oxytocin and ergometrin used to induce labor and to help control hemorrhaging after childbirth. Researchers with Ghana's Food and Drug Authority, in partnership with the Promoting the Quality of Medicine program, conducted a widespread investigation, and the program is implemented by USP, the United States Pharmacopeial Convention. Here's what they found. Some of what they found is more than 65% of the oxytocin samples did not meet the standard, and nearly 83% of ergometrin fell short of the standard. And in addition, the origin of 10% of the oxytocin samples and more than 4% of ergometrin samples could not be established, meaning they were probably fake or counterfeit. Experts say the use of fake and counterfeit drugs can lead to severe complications, even death. And joining us now is Dr. Patrick Lukulay, Vice President of Global Health Impact Programs with the U.S. Pharmacopeial Convention. Dr. Lukulay, welcome to the show.
Thank you, Linord, for having me.
Now, this, I have to say, when I read the report, it was very troublesome. What is the significance? What can we take away from this?
Well, the results of this study are very disturbing in several aspects. The first aspect is that you have oxytocin, which is used to prevent postpartum hemorrhage, bleeding in women having birth, and having a drug that does not have the right amount could lead to women bleeding to death, or in some cases that we found where you have the drug in the right amount, it was not sterile, meaning that it was prone to have bacteria or microorganisms, which could lead to infection for the woman. And so it's really a double whammy. You either don't have the right drug to prevent postpartum hemorrhage, or the drug is there, but it's not sterile and could lead to infection and death as well.
And that's very, very troublesome again, as I said earlier. Now, in this specific case, this happened in Ghana, of course, but counterfeit and substandard drugs are not a problem, obviously, just in Ghana. What did the government, what kind of measures did they take in this specific case?
Well, I really would like to applaud the Ghana Food and Drugs Authority for the prompt action they took to withdraw and recall the products involved, as well as take regulatory action by actually prosecuting some of the wholesalers and the pharmacies that were involved. This is an action that is worth applauding, because we recognize how difficult sometimes making these tough decisions can be, but they have been very forthcoming to address the problem and take immediate action so that patients are not exposed to this.
And it's worth mentioning that some of the products that were sampled were actually from sources that were legitimate, where you go and buy your products, such as the pharmacy, the doctor's office, and that's really a problem.
Correct. That is very problematic. This is problematic because this really reveals systemic problems within the supply chain. All right, problems ranging from the procurement systems that are used, the regulatory systems that are supposed to stop these bad products from getting to the patient. These results reflect that there are issues with these systems, and they have to be addressed immediately. Otherwise, patients continue to be exposed to this type of problem.
And what type of lessons can other countries learn from this?
Well, the lessons to be learned are, the first one is, and I'm very serious about this one, is government procured products should not be immune from regulatory oversight. I often come across ministries of health where procurements are done within those ministries, and the products do not even go through the regulatory authority in order to vet the product and allow or disallow them, because they say it's a donated product from overseas or it is procured by the government. The lesson here is no product is immune from regulatory oversight. The regulator has to access and vet every pharmaceutical product that is used for the population in that country.
Okay, Dr. Lukulay, thank you so much for joining us today.
It's a pleasure, Lina. Thank you.
And that's our Africa Health Network report for today. For more news and development on health, be sure to visit our website, africahealthnetwork.com.